Hello and welcome back to Living Local. Family Care Center provides the community with specialized behavioral health care. Now, more than ever, it's so important to maintain your mental health, guys. Joining me with more on why it's so important is CEO and Medical Director, Dr. Chuck Weber. Good morning, Chuck. Thank you so much for being with us this morning.
Good morning. Thank you for having me.
So, with all of this going on, why is it so important to continue your mental health treatment?
Well, I mean, especially in times like this with this increased stress and what's going on with the social isolation. I mean, we are social creatures, right?
Right.
And so whenever we isolate, that's going to exacerbate significantly mental illness, going to exacerbate depression, definitely for sure. And so even as we're kind of reducing and flattening this curve, even the CDC has recommended keep your mental health appointments. You can increase your stress, you can worsen your sleep, and ultimately that actually does suppress your immune system. So you can actually make your susceptibility towards COVID-19 a little bit higher by not seeking mental health. So please keep your appointments.
So keeping your appointments, how are you able to do that? What are some ways that people can keep their appointments if they don't want to come in?
Sure. Well, I mean, here at Family Care Center, we're definitely meeting the patient where they're at, right? We're gonna do what we can and convert those to telemedicine. Now, also, the Colorado State, the DORA, has said that we can actually convert those appointments to telemedicine and also even a telephone conversation. And so if they don't have all the accoutrements to do the telemedicine, we still need a consent form, but Family Care Center will meet you where you're at. And I mean, even if we got you on the phone to seek help for medicine and for talk therapy, we're going to do that. And to include, we do have 5 locations as well. Now, there are some things that are federal that we are not able to prescribe over the telephone or over the e-script. Those people have to come in, unfortunately.
Okay, so with everything that's happening, I know that you see it on social media. I hear it from friends. People are scared. They are worried about what's going to happen, or they have this. What do you tell people like that? How can they cope with those kinds of feelings?
I mean, this is difficult. This is where we want to really have that individual connection and have that, those appointments to kind of talk them through that and kind of understand and meet them where they're at. I mean, in general, we do tell them to make this new routine. And even with this great channel, we ask them and urge them to kind of parse out the social media and the news.
Yeah.
To say, hey, let's have a time that we're going to just kind of see this particular portion, get up to date, but not to spend 24/7 on it. This can really kind of increase our anxiety.
Right.
To even quote kind of.
Go ahead. I'm sorry.
No, to quote kind of even C.S. Lewis when they're talking about the atomic bomb, and if we change that to the COVID-19, I mean, the threat is serious and real, all right, but it's not novel. I mean, we have, as human beings, as Americans, we've dealt with a lot, and so modern medicine has kind of changed this, where we're not that we're immune with infections, as you know now, but we've really kind of left it as part of our history, and so I'd say, make that new routine, exercise, live, love, pray, go find your faith again, and continue to live your life.
I think that's incredible advice, and I cannot thank you enough for joining us this morning. He said, get outside, eat, pray, love. All great advice. Thank you so much for being with us, Doctor. I really appreciate your time this morning.
No, thank you so much. Appreciate it.
If you need some more information, you can go to fcsprings.com. This segment has been sponsored by Family Care Center. Stick with us.